Hey everyone, and welcome back. Ready for another deep dive? Today, we're going deep beneath the surface of psoriasis.
Ooh, that's a good one.
We'll be using the latest research from places like the American Academy of Dermatology, the National Psoriasis Foundation,
Of course.
and the Mayo Clinic.
All great sources.
But get this, we're not just talking about skin.
Okay.
Psoriasis is actually an autoimmune disease. Plus, we'll even be looking at how your gut health might be involved.
It's amazing how much we're learning about these connections, right? And psoriasis is a perfect example of that. It's not just skin deep.
Right. So much more to it.
Definitely.
To kick things off for anyone who's maybe not familiar, let's clarify what exactly is psoriasis.
Well, in a nutshell, psoriasis is a chronic autoimmune condition. So basically, your immune system, the one that's supposed to protect you,
Right.
it kind of goes rogue and starts attacking your own skin cells.
Oh, wow.
And that messes up the whole skin cell production cycle. They pile up on the surface instead of shedding normally.
Right, they're supposed to.
Exactly. And that's what creates those red, itchy patches we know as psoriasis.
So it's not just a simple rash or dry skin.
Nope, definitely not. It's an internal process that's gone a bit haywire.
So is this something you're born with, or can you develop it later?
It's a bit of both, actually. You might be genetically predisposed to it,
Okay.
but it can stay dormant for years, and then, bam, something triggers it.
Interesting.
Could be stress, an infection, or even just an injury to your skin.
Like a cut or something.
Exactly.
So my genes and my environment both play a role.
You got it?
Okay. Now, I've heard there are different types of psoriasis.
Uh-huh.
Do they all look the same?
Not at all. There are a few different kinds, and each one looks pretty distinct. The most common is plaque psoriasis. That's the one with those thick red patches and silvery scales.
Okay.
Usually see it on elbows, knees, the scalp.
Oh, yeah, those are the classic spots.
Right. But then there's guttate psoriasis, which is more like small, drop-shaped spots.
Guttate. Now, doesn't that one usually happen after you've been sick?
You're right on the money. Often triggered by an infection like strep throat.
Interesting.
And it tends to hit kids and young adults more than anyone else.
Huh. So it's like your immune system is fighting off the infection.
Yeah.
And then it gets a little confused and attacks your skin, too.
Basically. It's pretty wild, right?
Totally. Any other types we should know about?
Well, there's pustular psoriasis, which honestly is less common,
Yeah.
but it can be pretty serious.
Oh,
It involves white pustules surrounded by red skin.
I see.
And in really bad cases, people might even need to go to the hospital.
Gotcha. Well, it's definitely clear that psoriasis is a lot more than meets the eye.
You said it.
So besides the obvious patches, what other symptoms should people watch out for?
Oh, man, where do I even begin? Besides just looking at it, psoriasis can be super uncomfortable.
Like how?
Think intense itching, burning soreness.
Oof, not fun.
And get this, there's this thing called the Koebner phenomenon.
What's that?
Even a minor skin injury, like a scratch or a bug bite, can actually trigger new psoriasis patches.
So like even more.
Yep. It's like your skin is on constant high alert, just waiting for something to set it off.
Wow, I had no idea it was that sensitive.
Yeah.
Are there other things besides an injury that can make it worse?
You bet. Stress is a huge one.
Oh yeah, stress is the worst.
It is. And then things like cold weather, smoking, drinking alcohol can all make symptoms worse.
I see.
And even some common medications can be triggers.
Really? Like which ones?
Things like beta blockers or lithium, for example.
Huh. So many things to think about.
Right. It's a really complex interplay of stuff happening both inside and outside your body.
Okay, so if you think you might have psoriasis, it's important to pay attention to all these potential triggers.
For sure.
But how do you actually know if it's psoriasis? Like what happens when you go to the doctor?
Well, diagnosis is usually fairly straightforward.
Good.
A dermatologist will take a look at your skin, check for those classic signs.
Okay.
Ask about your medical history, any family history of skin conditions, and what triggers you might have noticed. They might take a small skin sample, a biopsy, just to confirm and rule out anything else.
Gotcha. So getting a diagnosis is pretty clear cut, which is good.
It is.
Now the big question, how do you treat it? Is there like a cure?
I wish. Sadly, no magic cure for psoriasis yet. It's chronic, so it requires long-term management.
Oh, bummer. But at least there are treatments, right?
Oh, absolutely. And there are lots of good options out there these days.
So it's more about managing the symptoms and preventing those flare-ups.
Exactly.
Okay, well, walk us through it. What are some of the things people can do?
Oh, it often starts with topical therapies, creams or ointments you put right on the affected skin.
Okay.
Corticosteroids are usually the first line of defense because they reduce inflammation.
I've heard of those.
Then you've got vitamin D analogs to help slow down skin cell growth.
Got it.
retinoids to normalize skin cell turnover, and even good old coal tar, which has been used forever to soothe the skin.
Coal tar. That sounds kind of old school.
It is! But hey, if it works right.
True. So we're saying topicals are more for milder cases.
Yeah. Usually, yeah.
What about when it's more severe? What are the options then?
For those tougher cases, we might look at phototherapy,
What's that?
using UV light to treat the skin.
Oh, interesting.
There's a specific kind called narrowband UVB that's really effective for psoriasis. There's also PUVA, which combines a medication with UVA exposure, but we usually save that for the really stubborn cases because it can have some long-term risks.
Risks? Like what kind of risks?
Well, with PUVA specifically, there's a potential for side effects, especially if you use it for a long time.
Okay.
It can increase your risk of certain skin cancers and even cause premature aging of the skin.
That's no good.
Nope. So we only use it when other treatments haven't worked, and we always do it very carefully.
So you really have to weigh the pros and cons with that one.
Absolutely. It's a decision we make together with the patient, considering all the factors.
Okay, that makes sense. What about if someone's tried topicals and phototherapy and still nothing seems to be working? Are there other options?
You bet. We've got a whole category of medications called systemic medications.
What are those?
These work throughout your whole body.
I see.
Some of them, like methotrexate, cyclosporine, and acitretin, have been around for a while. They can be really effective, but they also have potential side effects, so we monitor patients very closely.
So more powerful medications, but with potential downsides.
Right. So we got to be careful.
What does that monitoring look like? What do you actually do?
It really varies depending on the specific medication.
Okay.
But usually it involves regular blood tests to check on liver and kidney function. And we're always watching out for any other side effects that might pop up.
Right. So it's a team effort between the doctor and the patient.
Exactly. It's all about open communication and working together to find the best approach.
Okay, I like that. Anything else in the treatment toolbox?
Oh, yeah. This is where it gets really exciting. Biologics.
Biologics. I think I've heard of those.
These have been a total game changer for psoriasis treatment.
How so?
They're basically genetically engineered proteins that target very specific parts of your immune system, the parts that are involved in inflammation.
So they're like super precise.
Exactly. Think of them like smart bombs going after the exact culprits causing your psoriasis.
Cool. And how do they compare to those older medications we talked about?
Well, the older meds tend to suppress your entire immune system, but biologics are much more targeted, so they often have fewer side effects.
That's great.
They've been incredibly effective for a lot of people with moderate to severe psoriasis.
Wow, that's amazing. But are there any downsides?
Well, they can increase the risk of infections.
Ah, I see.
So we still have to monitor patients carefully.
Makes sense.
And they can be pretty expensive, which unfortunately is a barrier for some people.
Right, so they sound very effective, but not without their challenges.
That's about right.
Are there any specific biologics you can tell us about?
Sure. Some of the most well-known are adalimumab, etanercept, and secugamab. They've all been proven to work really well at reducing inflammation and clearing up skin.
I'll have to look into those.
And there are even newer treatments like apremilast and IL-17 and IL-23 inhibitors that are showing a ton of promise.
Wow, lots of new options coming out.
It's really encouraging to see.
Definitely. So it sounds like there's real hope for people with psoriasis to find a treatment that works for them.
Absolutely.
But meds aren't the only thing, right? You mentioned lifestyle changes before.
Oh, yeah.
What role do those play in managing psoriasis?
Lifestyle's huge. Taking a holistic approach is absolutely essential for long-term success.
Okay.
That means things like quitting smoking if you smoke, limiting alcohol, managing stress.
Yeah, we talked about those triggers earlier.
Exactly. Got to address those underlying factors.
And I know a lot of people struggle with making those lifestyle changes,
Yeah, it's tough.
especially when you're dealing with a chronic condition that can be really stressful.
It's a lot to handle.
What advice would you give to someone who's feeling overwhelmed and just doesn't know where to start?
I get it. It can be super overwhelming.
Yeah.
My advice would be start small. Pick one or two things to focus on at first and celebrate your successes along the way.
Good advice.
And remember, it's not about being perfect. It's about progress.
I like that.
Even small changes can make a big difference over time.
Definitely. Okay, so we've talked about the physical side of things,
Mm-hmm.
but psoriasis isn't just physical, right? It affects you emotionally too.
Oh, absolutely. It can really take a toll on your mental health and overall quality of life.
Yeah, I imagine it could be tough to feel confident when you have a skin condition that's so visible.
It is. And it's understandable to feel self-conscious, embarrassed, even ashamed.
Plus, the constant itching and discomfort has got to be draining.
It is. It really is. It can be incredibly frustrating and just plain exhausting to deal with.
So what can people do to cope with those emotional challenges?
Well, talking to a therapist or a counselor who specializes in chronic skin conditions can be really helpful.
Therapy is always a good idea.
Right. They can provide support, coping strategies, techniques for managing stress and anxiety.
Makes sense. Any other resources that might be helpful?
Support groups. They're a fantastic way to connect with other people who truly understand what you're going through.
Because they're going through it too.
Exactly. Sharing experiences, tips, and advice can be incredibly empowering.
That makes sense.
And the National Psoriasis Foundation has a great network of support groups, both online and in person.
Oh, great.
Plus, their website has a ton of info and resources.
So the National Psoriasis Foundation is definitely a must-visit for anyone dealing with psoriasis.
Sure.
We'll make sure to include a link in the show notes.
Sounds good.
But don't go anywhere yet. This is just part 1 of our deep dive.
That's right.
We've got a lot more to cover, including some fascinating stuff about the gut microbiome and how it relates to psoriasis.
That gut connection is mind-blowing.
It is. So stay tuned, because in part 2, we'll be exploring all that, plus natural remedies and how your diet can play a role in managing psoriasis.
Can't wait.
Neither can I. See you all next time.
Welcome back to our psoriasis deep dive.
Still thinking about those biologics.
Yeah, they're pretty amazing.
Definitely seems like there have been a lot of advancements in treatment.
Huge progress. And we're learning more about what actually causes psoriasis too, which helps us develop even better treatments.
Speaking of causes, let's get back to the gut microbiome.
Okay.
I want to hear more about that.
It's fascinating stuff.
So you mentioned this thing called gut dysbiosis.
Mm-hmm.
Can you explain what that is and how it relates to psoriasis?
Sure. Basically, gut dysbiosis just means there's an imbalance in the bacteria that live in your gut.
Okay.
Everyone has trillions of bacteria living in their digestive system.
I know, it's kind of gross when you think about it.
It is kind of.
Yeah.
But they're actually really important for our health.
Right, the good bacteria.
Yeah, and when you have dysbiosis, it means that balance between the good and the bad bacteria is off.
I see.
And that can actually trigger or worsen a whole bunch of different health problems, including psoriasis.
So are there like specific bad bacteria that are linked to psoriasis?
Yeah, research is pointing to a few culprits.
Right.
For example, studies have found that people with psoriasis tend to have lower levels of certain good bacteria, like Akkermansia mucinifila.
Wow, that's a mouthful.
It is. But on the flip side, some potentially harmful bacteria like Streptococcus seem to be more abundant in people with psoriasis.
So it's not just about having good or bad bacteria, it's about having the right balance.
Exactly. It's all about that delicate ecosystem in your gut. When it gets out of whack, it can have all these ripple effects throughout your body.
Including on your skin.
Yep. And scientists are still working to figure out exactly how all these pieces fit together, but it's a super exciting area of research.
It is really interesting. So while we're on the topic of natural approaches, let's talk about home remedies.
Okay.
What are some things people can try at home to soothe their psoriasis symptoms?
Oh, there are a bunch of things that can help. Aloe vera is a classic one.
Aloe vera, yeah. Good old aloe vera.
It's a go-to for soothing irritated skin for a reason. It's got anti-inflammatory properties, so it can help reduce redness and scaling.
I feel like aloe vera is good for just about everything.
Pretty much. It's a miracle plant.
Are there any other remedies that are particularly good for psoriasis?
Oatmeal baths. Soaking in an oatmeal bath can be super soothing.
Interesting.
Oats have these compounds that help calm inflammation and lock in moisture, which is super important for psoriasis.
To keep that skin hydrated.
Yep. And Dead Sea salt baths are great too.
What do those do?
They gently exfoliate the plaques and provide some relief.
Exfoliation sounds good, but I always thought you had to be really gentle with psoriasis.
Oh, you definitely do.
Is there a risk of irritating your skin more with a salt bath?
It's possible, yeah. Especially if your skin is super sensitive.
Okay.
So start slow.
Got it.
Short bath time, lower concentration of salt, and see how your skin reacts.
Good advice.
And always moisturize well afterward.
Always. That seems to be a recurring theme here, keeping that skin hydrated.
It is. It's super important for managing psoriasis.
Makes sense. Are there certain ingredients we should look for in a moisturizer?
Yeah, look for thick, creamy moisturizers or ointments that contain ceramides.
Ceramides, what are those?
They're lipids that help restore your skin's natural barrier and lock in moisture.
Okay, so thick and creamy ceramides, check.
You got it.
Any other skincare tips for people with psoriasis?
Be gentle. Avoid harsh soaps or scrubs.
Makes sense.
And when you're drying off, pat your skin dry instead of rubbing.
Oh, that's a good tip.
Even small things like that can make a difference.
True. Okay, let's shift gears a bit and talk about diet.
Okay.
What's the connection between what you eat and your psoriasis?
That's a great question, and honestly, we're still learning a lot about it.
Okay.
But we do know that inflammation plays a huge role in psoriasis.
Yeah,
So eating a diet that helps reduce inflammation in your body is a good place to start.
that makes sense. So what does an anti-inflammatory diet look like? What kinds of foods should we be eating?
Load up on colorful fruits and veggies, berries, leafy greens, bell peppers.
The rainbow diet?
Exactly. They're packed with antioxidants that fight inflammation.
I love those foods anyway.
And fatty fish like salmon, mackerel, sardines are great too.
For the omega-3s.
You got it. Omega-3s are powerful anti-inflammatory agents.
So eat the rainbow and don't be afraid of healthy fats.
Perfect summary. Now, what about foods to avoid? Well, generally you want to limit things that promote inflammation.
Like
Sugary drinks, processed foods, red meat, refined grains.
all the usual suspects.
Right. But dairy is a tricky one.
Oh, yeah. I've heard that some people with psoriasis avoid dairy.
Yeah, it's a bit of a mixed bag.
How so?
Well, dairy contains a type of fatty acid that can promote inflammation in some people.
Okay.
And some folks with psoriasis find that cutting back on dairy helps their skin clear up.
So it's really an individual thing.
It is. The best way to know if dairy is a trigger for you is to try an elimination diet.
What's that?
You cut out dairy for a few weeks.
Cold turkey.
Yep. And then slowly reintroduce it and see if your symptoms change.
That's a good way to pinpoint any food triggers you might have.
It really is.
What about gluten? We touched on that earlier. Is there a clear link between gluten and psoriasis?
It's a little more complicated than that. There's definitely a connection between psoriasis and celiac disease.
Which is?
Celiac disease is an autoimmune condition where your body can't handle gluten.
Okay.
But even for people without celiac, some find that going gluten-free helps their psoriasis.
So gluten could be a factor even if you don't have celiac.
It's possible. If you're curious, the best thing to do is try an elimination diet and see what happens.
So like with dairy?
Yep. And if you notice a big improvement, it might be worth sticking with a gluten-free diet or talking to your doctor about getting tested for celiac.
Makes sense. It's really fascinating how connected everything is, like our gut health, our diet, our skin.
It really is.
It all ties back to that holistic approach you were talking about.
Absolutely. And we can't forget about stress either.
Oh yeah, we talked about that as a trigger too.
It's a big one. The mind-body connection is super powerful.
I believe it.
When you're stressed, your body releases hormones that can trigger inflammation.
Which then makes psoriasis worse.
Yep. And that can lead to even more stress. It's a vicious cycle.
That sounds awful. What are some things people can do to manage their stress levels?
It's so important to find healthy ways to cope with stress.
I know, but easier said than done, right?
It is. It definitely is. But even small changes can make a big difference.
Okay, what kinds of things?
Things like mindfulness meditation, deep breathing exercises, yoga, spending time in nature.
So just finding ways to relax and unwind.
Exactly. Whatever helps you de-stress.
Are there any specific techniques that you find particularly helpful for your patients?
Mindfulness meditation is a really good one.
Okay.
It's all about focusing on the present moment without judgment.
I've heard of that.
It can be super effective for calming your mind and reducing stress. There are tons of guided meditations online and through apps you can try.
Cool. I'll have to check those out.
Definitely. It's worth experimenting to find what works for you.
Makes sense.
Yeah.
So mindfulness, nature, those are all great.
Yeah.
But let's switch gears one more time and talk about skincare.
Okay.
What are the must-dos for people with psoriasis?
Well, we've already talked about moisturizing a lot.
Moisturize, moisturize.
Right. But it's worth repeating because it's just that important.
It keeps coming back.
Keeping your skin hydrated helps prevent dryness and cracking, which can make your symptoms way worse.
Got it. What else?
Be mindful of the water temperature when you shower or bathe.
Okay.
Hot water can actually strip away your skin's natural oils and dry it out even more.
So lukewarm is better?
Yep. And use a gentle, fragrance-free cleanser.
Good to know. What about sun exposure?
Ah, yes, the sun. That's a tricky one.
Because?
A little bit of sun can actually be good for psoriasis.
Really?
Yeah, the UV rays can slow down skin cell growth.
Ah.
But too much sun can trigger flare-ups and make your skin super sensitive.
So a little is good, but too much is bad.
Exactly. It's all about finding that balance.
So how do you protect yourself if you were going to be out in the sun?
Always wear sunscreen. SPF 30 or higher,
Okay.
even on cloudy days.
Really?
Yep. And be extra careful if you're taking any medications that make your skin more sensitive to the sun.
Makes sense.
Talk to your doctor about what precautions you should take.
Got it. Sunscreen always. It seems like taking care of your skin is a full-time job when you have psoriasis.
It can feel that way sometimes.
But it's important.
It is. And remember, it's not just about the physical stuff.
Right.
The emotional side of things is huge, too.
We talked about that a bit earlier.
Living with psoriasis can be emotionally challenging.
It's understandable.
You might feel self-conscious, embarrassed, ashamed.
Yeah,
And the constant itching and discomfort can be so frustrating and exhausting.
totally get it.
So if you're struggling, know that you're not alone.
Good reminder.
Millions of people have psoriasis. So there are tons of others out there who understand what you're going through.
Yeah, for sure.
Don't be afraid to talk to someone about how you're feeling.
Right.
Could be a friend, family member, therapist, support group.
Support is so important.
It is. It can make all the difference.
Are there any resources you recommend for people who are struggling?
Definitely check out the National Psoriasis Foundation website.
We'll link to it.
They have a ton of information on coping strategies, support groups, mental health resources.
That's good to know.
And there are a lot of great online communities and forums where people with psoriasis can connect and share their experiences.
So it's all about finding that support and knowing that you're not alone in this.
Exactly.
We've covered a lot of ground in this.
Right.
From the science to the treatments, lifestyle changes.
Lots of info.
What do you think is the most important takeaway for our listeners?
I think the most important thing is to remember that you have the power to take control of your psoriasis.
That's a good message.
It might feel overwhelming at times, but by working with your healthcare team, learning about the condition-making informed choices, you can manage your symptoms and live a full life.
I love that.
It's not about finding a cure. It's about finding what works for you and taking charge of your health.
So empowering. Well said.
Thanks.
And don't forget, we have one more part to go in our deep dive.
Right.
We'll be exploring the latest research and exciting new developments in psoriasis treatment.
The cutting edge stuff, we'll talk about personalized medicine, new biologics, and advancements in our understanding of the gut-skin connection.
Stay tuned, everyone. You won't want to miss it.
Welcome back to our final part of this deep dive into psoriasis. I'm really excited to hear about these new developments you mentioned.
Me too. There's just so much happening in psoriasis research right now. It's really a fascinating time to be in this field.
So where do we even begin? What are some of the areas you're most excited about?
Well, personalized medicine is a huge one.
Okay.
Scientists are working on identifying specific genes and biomarkers that can predict how a person will respond to different treatments.
So basically using your DNA to create a custom treatment plan. Exactly. It's all about moving away from that one-size-fits-all approach.
Because everyone's different.
Right. Everyone's unique, and their treatment should be too. This could lead to better outcomes, fewer side effects, and even save money in the long run.
It's like something out of a science fiction movie. Tailoring treatments to your genes.
It is pretty amazing. And it's not just science fiction anymore. It's becoming a reality.
Wow. So what else is in the pipeline? Any new treatments being developed?
Oh, absolutely. Lots of new biologics in development.
Even newer than the ones we talked about before.
Yep. These target different pathways in the immune system, so they offer even more targeted approaches to controlling inflammation.
So even more precise.
Exactly. And some of them might be even more effective and have longer-lasting results. Plus, researchers are working on making them more convenient to take.
How so?
Like oral medications or injections you can give yourself at home.
That would be huge.
Right. It could really improve people's quality of life.
Definitely. Now, what about the gut microbiome research? Any breakthroughs there?
Oh yeah, tons of cool stuff happening in that area.
Like what?
Well, scientists are working on identifying the specific strains of bacteria that are linked to psoriasis.
Okay.
And they're even looking into fecal microbiota transplantation as a potential treatment.
Fecal transplants for psoriasis.
Right, I know it sounds crazy. But it's actually showing a lot of promise for other conditions like inflammatory bowel disease. The idea is to transplant healthy bacteria from a donor into someone with psoriasis to help restore balance in their gut.
Wow. It's amazing to think that something like that could potentially impact a skin condition.
It really highlights how interconnected our bodies are.
It does. So are there any other cutting-edge research areas you want to mention?
Well, there's also a lot of focus on diet and lifestyle interventions.
Okay.
We talked about the anti-inflammatory diet, but researchers are digging deeper into specific dietary compounds that might help.
Oh, interesting. Like what?
Well, polyphenols, for example.
What are those?
They're found in fruits and vegetables, and they might have a role in reducing inflammation.
So it's about more than just eating healthy in general.
Exactly. It's about understanding how those individual components in our food interact with our bodies.
Makes sense. Anything else?
Yeah. There's a lot of research happening on the impact of things like exercise stress reduction and sleep on psoriasis.
So it really is about taking that holistic approach we talked about.
Absolutely. Got to look at the whole picture.
Well, it sounds like there are a lot of reasons to be hopeful about the future of psoriasis treatment.
There really are. This field is just exploding with new research and new possibilities.
I love that. So anything else you think our listeners should know?
Just remember there's hope. New treatments are on the horizon, and we're learning more and more about psoriasis every day. It's an exciting time to be dealing with this condition.
I love that. What a great message to end on. Well, this has been a fantastic deep dive into the world of psoriasis.
It has.
We've covered so much, and I feel like I've learned a ton.
Me too. Always happy to talk about psoriasis.
Well, don't forget, everyone, we've got a ton of resources linked in the show notes if you want to learn even more.
Definitely check those out.
Keep learning, keep exploring, and keep advocating for your health. Until next time, stay curious, stay informed, and keep diving deep.